I'm Sheila Jackson. I'm a GP in Barnoldswick, East Lancs.
I'm Julie Cowgill, the Registered Care Manager here at Cravenside.
My practice covers 3 care homes, 2 are in Barnoldswick and 1 is a couple of miles outside. Altogether within those care homes there are between 45 and 50 residents that my practice covers.
We've got 43 residents. We can accommodate 45. We have a 15-bedded dementia unit. The residents on that unit, we have higher staffing levels because the service users' needs are higher than the residential clients.
The reasons that we go to visit them are many and varied. So sometimes it can be swollen legs, sometimes it's skin rashes, coughs and colds often, or a bit chesty. Sometimes they become more confused. Sometimes they're distressed and we're not quite sure why, because a lot of them do find it quite difficult to communicate. The residents often have multiple problems. Many of them have memory problems and several physical problems. Obviously, because they're care home residents, they don't come to see us in the surgery. Before telemedicine, we generally got around 12 calls a week for care home residents. We usually went out to them because it was quite difficult to deal with them over the phone.
Before we used telemedicine, we used to either ring a GP direct for a home visit, use 111 out of hours for advice, or dial 999. Since telemeds has been installed at Cravenside, we think differently. Telemeds is always our first point of call.
It's quite simple. They talk to the patient, and then if they feel the patient needs a prescription or a visit, they just phone and pass the message on to one of our receptionists. And because we trust them, we know that they're reliable and do a good job, we're quite happy to either just issue a prescription or go and visit the patient. They also send through a written summary of the consultation and what the problem is, what they feel is needed. Telemedicine's made a huge difference to the number of visits, but also it means that the care home residents can get immediate attention rather than having to wait to see the GP the next day.
Before using telemeds, we had, I'd say, about 4 GP visits per day. Yeah. Since using telemeds, we now see 1 or 2 doctors per week, which has drastically improved. It's helped service users at Cravenside because it keeps them in their home. It gives them reassurance that they've had medical advice. It's kept them here instead of having to go to hospital in an ambulance, which can be so distressing, and it's so costly as well because you've got to send a staff member with them.
I think the main advantage for patients is that they have 24-hour, 7-day-a-week access to medical advice. So they are no longer having to be told, wait until the next day or wait until after the weekend and we'll ask your GP. They can immediately speak to a highly qualified nurse who is usually able to deal with their condition without involving anyone else. The other huge advantage, I think, is when there's something goes wrong urgently, which often happens while we're in the middle of surgery. It's a dilemma for us because we're not sure how ill that patient is. We can go out and see the patient in the nursing home, but that then means leaving a queue of patients in surgery, which isn't good for them.
We did have an incident with a lady on the dementia unit that had a fall and she banged her nose. Telemeds actually got a consultant from A&E to come and have a look at her over telemeds, and he decided that she could be treated at Cravenside, and he sent a district nurse to see her here, which was fantastic, because that lady would never have coped going into an ambulance and going to the hospital. If we send a resident to hospital with dementia, it does have a knock-on effect with them. It takes us quite a few hours to settle them back into their environment. If it's during the night, they won't sleep. They feel so insecure and scared. So it takes a long time to resettle them.
I think there's huge potential for the use of telemedicine in the future. One thing that could be done within care homes is a thorough medication review, which would be great because these patients are on lots and lots of medication. Other possible roles, I would love to see it expanded to other housebound patients who aren't in care homes. Most of these patients have carers who visit them daily, and I would like to see these carers carrying with them an iPad to connect to the telehub. That could save us a lot of visits and allow early access as well to medical advice when it's needed.
Since using telemeds at Cravenside, I've felt it has improved the service that I can provide to my service users. I do feel it's a great benefit. It gives me peace of mind that I can get medical advice 24 hours a day.